Hey guys, it's me Nesha and I'm coming to you with another sickle cell vlog. What is sickle cell? So in this vlog, it's going to be a little different than my normal vlogs. My normal vlogs, I normally show you guys my everyday life with sickle cell. But I wanted to actually talk about what the disease actually is. I mean, I know I've told you guys, but I really want to tell you what the disease is. When I tell you about the disease, I'm not going to talk your ear off for hours and hours. I want to keep it short and sweet, but I also want to include the important things. A video on what this disease is, because everyone who comes across my videos don't understand why I do my vlogs. I do my vlogs to spread awareness about sickle cell so that maybe it can change how doctors, nurses, and other people treat people with the disease. And even for people who have the disease, we've been misinformed about some of the things about the disease. So I wanted to do a video basically letting everyone know what sickle cell disease is. Sickle cell is an inherited blood disorder that causes the production of abnormal hemoglobin. And if you don't know what hemoglobin is a protein that it attaches to the oxygen in the lungs, and it carries itself through the different parts of your body. Like everywhere in your body needs oxygen, and the hemoglobin basically gets it there. And the healthy red blood cells, for someone who doesn't have sickle cell, they're actually circular and disc-shaped, or like a donut, kind of round like a donut, and they're flexible and they're soft and spongy, and they can get through the blood vessels and travel through the body easily. Someone with sickle cell disease like myself, the hemoglobin is abnormal. I'm looking down at my notes because I want to make sure that I give you guys all the information that I have. The hemoglobin is abnormal, which causes the blood cells to be rigid and sickled, which is the name sickle cell. Causes them to be sickle shaped like a crescent, just like this, and C-shaped. And because of this, they're sticky and they stick together, and they're not flexible. They're not flexible at all. They're stiff. So what happens when these sickle cells are moving through your body, they get stuck on each other and they basically block the blood flow. So the blood cannot flow through the body. And because the blood can't flow through the body, it can't get oxygen to everywhere that it needs. So and when this happens, that's called a sickle cell crisis, because what happens is when they get stuck together, basically your body is going to alert you and let you know that something is wrong. It's not getting the oxygen that it needs in that area. So that's when the pain comes, or organ damage, and many other complications that I would have to do a totally another video on, as far as what would happen with the blood being blocked by sickle cell being stuck together. In order to inherit sickle cell disease, it's not contagious. You can't get it from touching something. You can't get it from touching me. You can't get it from touching my saliva, my blood, me coughing or sneezing on you. This is a disease that's inherited from parent to the child. So basically, I'm not going to go too deep into like genetics, but basically each person has 2 hemoglobin genes, and the mother passes on a hemoglobin gene and the father passes on a hemoglobin gene. For a person with sickle cell, both parents pass on the sickle cell hemoglobin gene, and that together equals the sickle cell disease. So as far as the lifespan with a normal red blood cell, it can live up to 120 days. And then your bone marrow, for those of you who don't know, your bone marrow produces your blood and pushes the blood out. So what happens is, by the time your old blood is dying off, your body's pushing out new blood. With sickle cell, our blood cells only live 10 to 20 days. So, which is why sickle cell people are anemic. So basically, the bone marrow can't produce the blood fast enough. So it that blood is dying off, and there's not more blood ready for it. So that's why people with sickle cell disease are anemic. Now, as far as a cure for sickle cell, there is a cure for sickle cell, but and I mean a big but. It can only be done to some sickle cell patients, not all sickle cell patients. First of all, you have to have a donor, and most of the time that donor is a sibling. You have to have a donor, and that donor is a sibling, and then if your doctor approves for you to go through this process, you can. I don't know all the ins and outs of it because it was not a choice or option for me. So therefore, I cannot be cured because the stem transplant, which is what it's called, is not an option for me. First of all, your doctor would recommend this, and you would have to really be having severe, even though some people, a lot of us have severe sickle cell problems, it's not severe enough for them to recommend us for the stem cell transplant. Now, as far as sickle cell, there is 70,000 to 100,000 Americans that have sickle cell disease. So this isn't like it's just affecting a few people. 70,000 to 100,000. That's a lot of people. Now, as far as sickle cell, it can affect any race. So for people that think like it's a black disease, or it's not just a black disease, it can affect any race. But it is most common in African descent, African American, Hispanic Americans, from Central and South America, people in the Middle Eastern, Asian, Indian, Mediterranean descent. So it doesn't just affect black people. Like, that's a stereotype that people think that sickle cell is just a black disease. It's not just a black disease. For the healthy red blood cells, for someone who does not have sickle cell, here's what a picture of it looks like. Now, for someone who has sickle cell disease, here's what a picture of that looks like. A sickle cell crisis, how it was explained to me as a child, or how the sickle cells work. If a donut is the normal blood cells, and a banana is the abnormal sickle cells. So if you were to have a tube sock, and you take that something circular and drop it through, it will come straight through. And that's how it should work in the body and the blood vessels and everything. It should work just like that. But if you were to take something that's sickle shaped and put it through that tube, it would get stuck. And that's what happened. So basically it would not be able to, like, if this was the tube, it would not be able to go through. It would get stuck because it's not flexible. Now, there is a difference in sickle cell disease and sickle cell trait. Sickle cell disease means that you have two sickled genes passed on from your parents. One from the mother, one from the father. Sickle cell trait means that you have one sickle cell gene. So one of your genes is normal and one of them is abnormal, the sickle trait. So a small genetics lesson on that would be sickle cell. A person with sickle cell trait is considered AS because normal hemoglobin is AA. So a person with the trait would be AS. So my parents both passed on their S to me. Well, in my case, a S and a C, because I have sickle cell disease type SC. My mother gave me the S trait and my father gave me the C trait. Together, I have two sickled cells, so I have the full-blown sickle cell disease.